Welcome to this week's episode of The Scoop. So this week I'm going to talk about periodontal disease. It's a big word for gum disease. A lot of people don't know a whole lot about gum disease. I think historically I see it underdiagnosed a lot. I see a lot of people who come in with some severe gum disease and they have no idea that they have it. I see other people who know that they have it and they've been battling it for a lifetime. So generally, if you do have severe periodontal disease, even mild, moderate, it's going to be a lifelong battle for you. So I want to explain what it is. So people know about bleeding gums, gingivitis. You hear about these kinds of things, but it's never really talked about what that does to your teeth if you let it progress, or what the process really is. So if you're my patient, I'm sitting in my dental laboratory right now. If you're my patient and you come in and I see this, I always use the same illustration to just explain this to a layperson. And I use just my sleeve and my hand and my watch. And I also did actually put some electrical tape on my arm to help illustrate gum disease. I don't do that every day, that's just for you guys. So what gum disease is, so if you just pretend for a moment that my fist is a part of the tooth in your mouth that you see, and my sleeve is your gums. So around your gums, there's a normal place right here where there's a pocket underneath. And if you recall going to your dental hygienist, and they take those numbers, those measurements all the time, what they're doing is they're measuring how deep this little pocket is around your tooth. We have an instrument that has millimeter markings on it, and we like those measurements to be between 1 and 3. That's normal. And they measure actually in 6 places on every tooth, so it's really a thorough exam. In between 1 and 3, maybe you got a little plaque here, normal, no problem. You start getting some tartar underneath here. This is my watch, okay, so my watch is tartar, let's pretend. The tartar can be sometimes above the gums, and you can work on, brushing's not really going to remove it, sorry, we need to remove it. But what gum disease is when you get the tartar underneath the gum line, so you can't see it. You're doing your job at home, brushing, flossing, whatever, you're not getting down in there. When I recommended the Sonicare, the Sonicare does help. When you hold the Sonicare against your gums, it kind of helps to rattle that junk out of there if it's not calcified. So there's another plug for Sonicare. Anyway, if you have this tartar underneath there and it's sitting there and you don't treat it, it'll start to grow further down your tooth. So somewhere under here, let's say it's this orange electrical tape, there is bone. So if you were to just pretend there's no gums there, there's your head, your jawbone is holding your tooth in your mouth. This bone here becomes irritated by tartar. So let's say my watch is growing, the tartar is growing, and it comes down to this bony level. The bone's not going to like that. Keep in mind your gums are still way up here. So the tartar's growing down inside, and that bony attachment underneath is going to start to pull away. So it's going to start to pull down. And that makes more room for the tartar. So the tartar will continue to grow down in, the bone will continue to pull away. So I put another piece of tape down there. Kind of nerdy, but it does illustrate it pretty well. So let's say this part's gone, okay? So now you only have maybe this much bone hanging onto your tooth. This becomes a problem, a big problem, because now the tooth may become loose, and that's how people lose their teeth to gum disease, periodontal disease. And oftentimes it doesn't hurt until it gets down here. So it can be difficult to, well, you can't know that you have it unless we diagnose it a lot of times. What happens is that you can't see it, and people will come in because their teeth are loose and it's far too late. Then I have to remove the teeth. So when we catch this early, what we want to do is get down inside of here. A dental hygienist will get down inside of here and clean that out. We'll get you numb for that, so that that's not a painful process. Get the tartar out of there, and then we'll monitor you pretty closely every few months and see how quickly it's coming back to make sure that the tartar doesn't continue to grow down and that you lose bone. Risk factors for periodontal disease. So if you're a smoker, you're at higher risk to get periodontal disease. Genetics is a big factor. And just oral hygiene. Take really good care of your teeth and see us regularly. Because like I illustrated, if you got this stuff growing underneath your gums, you just can't get that out at home. I don't care what product you're using. It's not going to help a whole lot. People ask me about antibiotics. Not going to help. They will help in the short term if you get an abscess or something. But generally this area, and this is an area of infection. So when I see it, sometimes, well, there's blood coming out of here. Sometimes there's pus coming out of here. People don't even know that. So antibiotics can treat an abscess in the short term, But the area of infection in between here doesn't have a good blood supply, so the antibiotics can't get to it. That's why they don't work very well. So you got to come in, see us, get it treated, and then being that these people have these risk factors, if you're a smoker, try to quit. Come see us regularly. It's just something that we need to get in and treat for you all the time. Make sure that it keeps clean down there. I had pulled this picture up, but I don't think it does a whole lot of good beyond what I've already explained. So that's kind of periodontal disease. There are specialists called periodontists who can treat this too. If we can't get everything clean, sometimes they need to do surgical procedures to get down in there and treat it better. So periodontists, that's what they do. Sometimes we refer to them as gum gardeners because they do try to get your gums to grow. It's irreversible once you lose that bone. There are some grafting procedures that can be done with limited results. So the best way to keep your teeth is prevention, and make sure that you're seeing your dentist for a comprehensive exam. They're taking a look at your gums for you. That's it for this week. Thanks.